Doctor, we have another patient. She has 38 degrees of temperature. In a moment, I will let her in, if you let me. Of course, let her in, please. Please, Mr. Sarina, take a seat. Hi, Mr. Serena. I'm the doctor in charge of the emergency office for the evening shift. I'm the Dr. Amy Pauline Garcia Medina. How can I help you?
I have pain in my stomach.
So, Mr. Sarina, before I can give you an accurate diagnosis, I need to get your basic data so I can continue with the questions focused on your current conditions. If you let me, of course.
Well,
I need to know first, what is your first name?
my full name is Sarina Lange O'Hare.
Okay. Serena Launch O'Hare. What is your age?
I'm 25 years old, doctor.
Okay. What's your marital status?
Married, but I have a boyfriend.
What is your occupation, Mr. Serena?
I'm a bartender since 5 years ago.
Do you suffer allergies?
Well, doctor, I'm a lactose intolerant, and that's the only thing I know.
Are you allergic to any medication?
I'm allergic only to penicillin.
Just in case that we need to do an surgical procedure, what is your blood type?
My type blood is AB positive, doctor.
AB positive. Now I'm gonna take your temperature. One moment. There. So please, Mr. Sarina, put the thermometer under your shoulder, please.
Well,
So, Mr. Sarina, I'm gonna question about how you feel to determine what causes the pain. Thank you. You have 38 of temperature. Well, how long have you had pain?
since I can remember, I have pain in my stomach since 3 days ago.
Does it hurt through your abdomen, or is it just in one particular area?
The pain travels to this area, and it get more painful here. Sorry.
When does it hurt? Always? Or more often in the morning or at night?
I feel it is hurting me all the time of the day. But sometimes I feel so bad, like right now. The strongest pain has no time to appear, just happens, like now.
Do you have more symptoms? I mean, something like headache, feeling like if you want to puke?
I have had a fever for these 3 days ago. We are talking about like 38 to 39 of fever. Um, and I have the feeling of the noses just a little bit.
Mr. Serena, are you in pain during your menstruation?
Yes, doctor. Most of the times it hurts a lot.
How long have you been hurting?
I have been hurting like 9 or 7 months ago. That's the thing that I can remember.
Do you take any medication or maybe herbal supplements?
Been on oral contraceptions for 7 months due to ovarian cyst.
Is there any activity or position that makes the pain worse?
Yes, doctor. When I sit down, like now, and when I lie down to my right side, the pain it gets worse.
Were you injured recently?
No, actually. The last time I get injured was like 5 or 4 years ago, but that doesn't causes me something like a major injury or something controversial.
Mr. Serena, the next questions that I am going to ask you is for to know more information about you before and after your harassment. Don't worry, doctor. I know the questions maybe are a little bit like makes me feel not comfortable, but I know that I need to tell you that because it's for the good of my health. At what age was your first menstruation, Mr. Serena?
My first menstruation, I remember that was at the age of 8 years old.
During your menstrual periods, your blood is abundant, or you consider that your period is abundant?
Well, I consider that my period is so abundant. I use 3 to 4 feminine pads a day because the blood is very abundant. But the color is not like cherry red, is more darker.
Are your regular periods regular? I mean, every month?
Yes, it is. My period is regular. I'm sure of that because I check my calendar period constantly and to make sure of the period is in order. But sometimes it takes another month, but that is not often, doctor. That's not often.
Do you have a female relative with a history of ovarian disease, uterine or cervical cancer, or even infertility problems?
Yes, two of my maternal aunts. One has infertility problem, and the other has polycystic ovary.
Do you have any of these problems?
Actually, to my bad luck, I have the same conditions of the two of my aunts.
Is your sex life active?
That is certainly the case.
When did you start your sex life?
At the age of 20 years.
Do you have a stable couple?
Yes, doctor. I have a stable couple and I have a boyfriend.
Do you use contraceptives in addition to your treatment?
Of course, my boyfriend used a condom to prevent illness or infection for both of us.
Okay. Do you have pain when having sex with your boyfriend?
Sometimes, but I don't tell that to my boyfriend. I feel a little bit awkward.
Do you feel pain when you urinated or defecated?
Yes, it feels sometimes, maybe more when I'm urinating, but that's not often.
Mrs. Arena, maybe we are talking about to a presumly case of endometriosis. That is why I already prepared you a reference shift to be evaluated by a specialist doctor in the gynecology area. His name is the Dr. Harry. He will do everything possible to detect your condition and give you an accurate treatment. And in the meantime, I give you a treatment to treat the possible infection that you have. I'm gonna give you right now the shift reference, and you're going to ask for the nurses of the gynecologist, and then you will give her the shift. And that's all. I hope you get better soon.